Begin this half hour with a check of the latest coronavirus numbers here. North Carolina reporting another spike in confirmed COVID cases, nearly 6,000 new infections in the past 24 hours. And we wanted to show you this as well. The number of COVID patients in the hospital topping 2,400, and that number climbing by about 100 patients, even more, nearly every day over the past week. So the pressure is certainly back on at hospitals. Every single one in our area reporting more and more patients coming in. It's leading to longer wait times for everybody and exhausting healthcare workers who have been on the front lines of this pandemic now, when you think about it, for a year and a half. WCNC Charlotte's Chloe Leshner joining us now with an exclusive look inside Novant Health's emergency department. Chloe, I'll bet it was something to see.
Yeah, it was really busy in there, Bill. There were people waiting in the hallways for rooms with beds. And the director of the emergency department told me that the number of patients that they're seeing has doubled in just the last week. And a lot of that is because of COVID. It's another busy night in the emergency department at Presbyterian Medical Center.
The ER here and throughout our community, all of them have been quite crowded and busy.
Dr. Josh Hughes ready to make his rounds. He says he'll see the typical injuries and traumas, but more than likely he'll be met with COVID patients too. The more contagious Delta variant is leading to a surge in exposures and positive tests, driving more people into the hospital.
Probably 100% increase in our hospitalizations just from about a week ago to this week.
Time in the waiting room is getting longer, and some patients have been left sitting in the ER waiting for a bed upstairs. Taking up some of the space are COVID patients who don't necessarily need to be there.
If somebody has an exposure and they're just looking for a COVID test and not having any symptoms, this is probably not your best place to come.
Of the COVID patients who are admitted, the overwhelming majority are unvaccinated. In turn, the ICU is also feeling the strain.
Statewide and nationwide, hospitals are full and trending towards capacity issues, and you'll definitely feel it presenting to any ED, in Charlotte, throughout Charlotte. It takes a longer time to get seen, to get through. We just don't have the resources to take care of everything immediately.
They're also seeing an increase in the number of people going to the children's emergency department, but they're not at the point of having to cancel elective surgeries just yet, and they still have the ability to surge and add some more beds. But the bottom line, if you want to help relieve some of the stress on the system here, only go to the emergency room if you're having a severe illness or COVID symptoms. Live at Novant Health, Chloe Leshner, WCNC Charlotte.